is having low back pain. So what can we do?
Now, the low back pain is becoming a pandemic actually. So irrespective of the age group, so we actually have the young ones, we have teenagers, you have even young adults, and even the geriatric population also experiencing this back pain. And so it's irrespective of gender, it's irrespective of age. The very important thing is that you need to look into those factors, and we actually have to do something to stem the prevalence of low back pain. Now, for example, bariatricity, that is obesity. If someone actually definitely the remedy to that is actually you have to get yourself under your body mass index have to be within the normal range. If you actually say, okay, you're gaining weight, you're becoming overweight, then the panacea to that is that what, okay, I need to reduce this weight, maybe through exercises, through dieting and what have you, just to really get your weight under control. Occupational exposure or hazard, repetitive task, or let me say awkward posture or poor ergonomics. Now, the best is that what, and that's what we're conversing. There is high time Nigerians, and especially in Lagos, that we should invest in ergonomics. That's the chair that you are sitting. Is very, very much important. A typical example of the chairs is that, for a proper ergonomic chair, you actually have to get one that has, neck support, back support, and you must have this lordotic cuff, to actually support, the lordosis of your low back. It must have armrest, and the weight must, wow, sorry, the height must be adjustable, so that irrespective of whether the exercise is a tall person or is a short person, it will be actually able to support the person's leg, and the leg must be at 90 degrees. So these are the things that are actually very, very important. Part of we must invest in ergonomics. The chair that we sit, and again, don't forget that we as humans, we sleep. Okay, let me say on average, 5 to 8 hours, depending on people how busy they are.
Not in Lagos.
Yeah,
8 hours is such.
Yeah, the proximity of your office or anything also is a factor. And I was in traffic, that was a difference today. It was terrible. It was really, really terrible. About 5 hours in traffic. Now, the mattress that you sleep in, is also very important, because if you're going to spend 5 hours, or let's even say 4 hours, of your life every day on bed, the quality of the mattress that you sleep, that is very, very important. You have to look for a mattress that actually supports the alignment of the spine. So it's right, and you get to ask someone on average, so I've been using this mattress, it's original, I've been using this mattress for the past 10 years. Come on, this is something you've been sleeping on every day. Of course, you never get the night of sleep. So, and that's why it's actually, we always get to converse. What you sleep on, very, very important. The chair that you sit on is very, very important. It's item, even the desk. And I guess we actually get into a kind of technologically driven age where everybody gets to use, the laptop, they get to use their system, they get to use their phones and everything. So the actually proper posture that must be maintained and assumed, in whatever you're doing, maybe working on your system or doing your day-to-day activities, very, very important.
I like how you have approached it, and we'll take a breather. But when we come back, I want to isolate these things that you have mentioned, and we start to deal with them practically, because these are things that affect all of us. Yeah. For instance, the quality of the mattress. Let's even the quality is far-fetched, but I don't know if I should say the consistency or the hardness or the softness.
Yeah.
We'll take that, and also the chairs that we sit in. For instance, somebody who's driving how many hours? How ergonomic can the chair be? So we'll isolate all of that and see what we can do, and of course help you, the listener. You know that you can be a part of the conversation. 014489981 is the number to dial, but WhatsApp is 0809444091.
Smoother than a fresh jar of skipping.
Trying to, yeah, pretty
love
good.
Music.
Trying to
love life.
Hey, it just feels good. 98.1.
Smooth. 98.1.
Just move your chair.
What does
here.
future forward
Where you are?
banking mean to you? Speed, innovation, convenience, lifestyle goals, or just simply getting service that is designed just for you? Yeah, we thought you might like all of that and more. That is why we specially created Providus Bank for you, to take care of your daily experiences. At Providus Bank, we believe that banking should be all about you and your business, and how to get you to the next level. If you do not already have a Providus Bank account, please speak with our business concierge.
So that thing was making noise. It was interfering in the audio.
684-387.
Yeah, that was why I said
or
you remove it.
email
And you were looking like an alien.
I'm saying cat. I didn't know it was quad.
Future
Sorry,
forward
man.
banking experience. Providus Bank. Future
Forward banking.
Let me tell you why you're here.
Zibby
You're
zibs.
here because you feel something. You have felt it your entire life. The vibe flowing through your veins. The rhythm beating in your heart. It's that feeling that has brought you here. The world of luxury, everyone's desire. It's more than just the classics, more than just old tunes. It's the new and exclusive, the taste of quality, a whole new world of music that's far beyond every song you know. It's a smooth, soothing music for your mind. Luxury Soul on Smooth 98.1 every Saturday from 4 p.m.
You can catch the genie as he serves you all the musical goodness. Of course, you know that he's the genie. He will grant your musical wishes. Right now, you're tuning to Breakfast in Bed here on Smooth 98.1. We are talking about your health and wellness. We're talking about spinal health, and we have started by giving you the background to what spinal health entails. And of course, the lower back pain, the neck pain, and the back pain itself. I have my guest. He is a seasoned physiotherapist. His name is Adejugbagbe Kenneth. Now, talking about low back pain, some data for you and why this is very important, aside the fact that you probably, if you are not having that pain already, you know somebody who does. So it is said that low back pain is arguably the most prevalent musculoskeletal condition found among both the developed and developing nations. So it's not just the developing ones, but also the developed nations. And it is said, according to a review published in 2007, that the prevalence of low back pain in Africa was comparable to that of developing nations, and it was rising. That was 2007. This is 2022. So of concern, like my guest mentioned, it is fast becoming a pandemic, and it is something to be looked into. And according to the Global Burden of Disease 2010 study, it is said that low back pain is currently the sixth highest burden on the list of 291 conditions, and is the cause of more years lived with disabilities globally.
That's correct.
That is, I don't like. So I'll give you a practical instance. For me, there was a time that I had this sharp and incapacitating pain in just the junction, I'll call it junction, between my back, and my waist. And it was so painful that I could barely move. The only thing left for me was to be using walking stick.
Wow.
It was
serious.
I don't know what happened until I went back to exercising. There were some particular stretching exercises that I did. And then I was tracking back and realized that I had been sitting way too much.
Yeah.
So before we went on that break, I said that we will come back to it and take one of these, each one of the things that you have mentioned, and attempt to just break it down and get practical with the solution. So let's talk about mattress.
Yeah.
Now, a number of people say the kind of mattress you should use is the one that is as hard as igneous rock. And some say it is better that you sleep in the form that assumes your shape, that is so soft like that of a baby. So you, as a physiotherapist, what kind of mattress should we sleep in, since it affects the way our spine fares?
Okay, yeah, that's a very important question. Just like we don't actually have limbs of one size fitting everybody, so it's not actually a principle cast in stone. So, like as we actually have people different, different morphology, different body sizes, different composition. So the same thing also applies to the mattress that actually supports their body. Now, the Nigerian Society of Physiotherapy, that is the body of that represent all physiotherapists. Actually, we've actually had this collaboration with quite a lot of mattress making companies, and we've done quite a lot of experiment.
Just make sure you don't drop your brand name, else you will
so,
have to
and
get
we
invoiced.
actually get to yes, we've approved quite a number actually. So now these are some people say okay, an orthopedic mattress, that's what's work for them and everything. So that's why it's always very good that you should meet the healthcare professional, as the physiotherapist in this regard. That's an orthopedic physiotherapist to also examine you. So we get to say, okay, if you get to lie down, you get to sleep on an orthopedic mattress. Does this actually help alleviate the symptoms that you have? Does it give you the necessary support, for your spine? Now, some people actually what works for them is a semi-orthopedic mattress. So there's a bit of cushion, and it's quite very much, it's gentler, on the skin and the muscles as against the orthopedic that's a bit very much rigid. So it depends. And some people you actually sit there and say, oh, whenever I sleep on the floor, that is actually how I feel relief and everything. And the most important thing is that what the curve of the spine must be supported. We're talking about neck pain and back pain. Even the pillow that you are using whether you're using a memory pillow or whether you're using any kind of brand of pillow whatsoever. The height of the pillow too is also very important. So if you're talking about a mattress, we must also be talking about the pillow. So people say, oh, I don't like sleeping with pillow because it tends to. So it's what works for you. So if you think actually you are divided and you're confused as to the choice that you have to make, then the best is for you to meet the healthcare specialist, that's a physiotherapist or your orthopedic physician to actually direct you in that regard.
That's very true because as you were explaining, I recollect some of the things. For instance, there was a time I didn't. My sleep and pillow were totally parallel. Anytime I sleep with my pillow, I would have back pain, sometimes neck pain, and then there was a time that if I sleep face down, I would wake up with this sharp pain in my back. So that brings us to it. The sleeping position too. I believe it affects.
Yeah, sleeping position actually affects. Now, this is the fundamental principle for whether you are sitting, you are sleeping, or you're resting or anything, is that the curves at the spine must always be maintained. Any mattress or any kind of this that you sleep, just like you have the neck, it's a bit, see inward, it goes inward. But that's why whenever you are using your phone, this text neck syndrome, and your neck is actually bent this way, you're obliterating the normal curve, the natural curve that is actually very much there. It should be, see inward, curved inward, and you must maintain a lordotic curve. The why they told us
your jargons now.
No, that's why I say see inward is just like the lordosis, like the curve inward, and that's the inside inward. So it must be maintained. So whenever you're sleeping, the pillow, like what you said, whenever you slept with pillow and you actually with terrible neck pain and spasm, it's most likely, let me say, the height of the pillow is quite very high, and that is actually pushing your neck forward. So that kind of situation, you actually have to get a pillow that actually helps to maintain the alignment of your neck to your shoulder and to your spine. So, and again, the same thing. So whenever you're sleeping, maybe say you're sleeping face up, you can actually get a little lumbar roll, a little small pillow, like a throw pillow, to put at your low back, just to push it a bit inside. And again, it's very much advisable that whenever you're sleeping too, you can also put a little bit of pillow to that is at the back of your knees, just to really help to support and also help with the alignment of the spine. So this actually it's not something that you can say, okay, this is what I saw on the internet. So it's very good. It will be very, very nice, and which is actually clinically advisable that you get to meet your expert in this regard, your physiotherapist, to say what works for you. Are you going to be doing sideline? So we say, okay, sideline is the best for them. Oh, so we say, whenever I sleep face up, I am fantastic with my pillows and with my little bit of support at the low back and at the back of my knee. So that's what works for them. So whether it's sideline, whether you're lying prone, that's lying face down, anything that works for you, it's always very nice that you should meet your healthcare professional in this regard, the physiotherapist, to see, okay, what works best for you.
Thank you very much. That was quite enlightening. But for some weird reason, when you mentioned lumbar roll, I thought of food. It sounded like fish roll or something to my head. Okay, so now let's go back to driving, because in Lagos, we need to, if we're going to help people, we need to talk about that. People spend a lot of time in traffic. What will be your general recommendation in getting, I don't know, you cannot get ergonomic driver's seat for yourself?
No, it depends on the car that you're actually using.
Okay.
Like actually, I had a client once, very tall man, and he used a saloon car. Of course, because his legs, there's no enough leg room, so he actually practically had to squeeze himself. So I said, so you can actually help yourself. You can actually get, let me say, an SUV or get a Jeep. And it's okay, yeah, he has actually been thinking of that too. And he just gave me, a phone call and said, since he got the SUV that has much more leg room, and he felt better. Like the chair is much more, instead of you reclined and you actually have to stretch it, you can actually sit upright and the spine was supported, the headrest is there, and again the cushion of is much more better. So for someone driving in Lagos, at least I as a driver in Lagos, there was a time the traffic was so terrible that I had to get a driver. And I tell you, like I had to get a driver for 6 months to drive me. I would rather pay, let me say, the 100,000 naira to a driver than for me to go, get it so much debilitating that I actually have to go for a surgery. So sometimes we actually get to have all these yellow flags pointed to you that, okay, you be careful, you be careful. But even while you're in traffic, there are some exercises that you can actually get to do when you're driving traffic. Yes. For someone actually, we have something dead buttock syndrome, especially when you're seated, your buttocks not working and everything. You can do some gluteal squeeze, where you just squeeze your buttocks for about 5 seconds, and you relax. You squeeze them while you're driving. Yes, it actually helps, with blood flow, and it also helps with the activity and an activation of the gluteal muscle. Sometimes I'm talking about the muscles of the buttocks. You can do some abdominal bracing. like the ladies actually get to do it, but they do it for the aesthetic reason. But it's actually a very fantastic and therapeutic exercise, whereby you
How do
say
you do that?
sucking belly. That's sucking of belly.
Oh.
So sucking belly makes pictures, belly makes the pictures more
Yeah.
beautiful and everything. But it's actually a very fantastic exercise. You're doing some kind of drawing maneuver. Your abdominally breaks up. You're activating your rectus abdominis and some other muscles actually that makes up the core. So it's actually a very fantastic one. A little bit of pelvic tilt. As you're seated in the traffic, you might actually have the luxury of coming out and stretching, maybe especially when it's a standstill. But you can actually do some kind of, pelvic tilt, forward and backward. At least people that are watching us on YouTube, they might actually be able to see what I'm doing. You do some pelvic tilt, forward and backward, as many times as possible. And if you said, okay, it's a standstill, better still, just calm down and do some just gentle stretches and mobilization. I tell you, it will go a long way, big time.
That is really, really good. I didn't think about that you could do some exercises
Yes,
in
you
traffic,
can. Yeah, you
squeezing and releasing.
Yes, make your squeeze, doing some kind of activation muscle setting. It actually goes a long way to help you.
That's good. That's really good. Now, you mentioned something about yellow flags and complications. What are the possible complications? I think we've dwelt quite a lot on that. Well, it's been across both neck pain and back pain and lower back pain. So what are the possible complications that this could have on an individual's health?
Yeah, you were talking about some epidemiology as regards low back pain. At least according to the global burden of the disease that's now specific to low back pain, we have about 575 million people living with, it's quite very deadly. That's 7% of the world's population. And this cause is responsible for absenteeism, presenteeism at the workplace. So, oh God, I can't come to work today. A lot of people, if you get to actually see all this health maintenance organization, most of the workers there is because of one low back pain, neck pain, talking about, spine issues and spondyloarthropathy or whatever, what you have. So in this, the yellow flags that you start seeing, okay, you're having a bit of spasm or you have a bit of radiating pain from your low back going down to your buttock and going down to your leg. Okay, that's when they say that something, something is actually ugly. So it's very much that you should just quickly go and present to the hospital. And you get to say, okay, you cannot move, or you get kind of maybe cracking or a kind of, let me say, some noises whenever you stretch at the back. Now, especially when that noise is accompanied with pain, because sometimes you can actually make some kind of cracky sounds and there's no pain. But when you actually, you try to move this way, maybe to the right, bending or extending your back, and you see that what's accompanied with pain, then you may actually have to go see your physiotherapist or go see your orthopedic physician. And again, you start saying that, okay, it's a bit warm at the back. You touch it, when there's a kind of differential warmth. The other part of the body is a bit, cold, but you see that your back is getting hot, it's getting, warm to touch, it's getting swollen, it's getting red. Okay, that is actually very much, it's a pointer that something pathological is actually happening at the back. It might be nothing. It might just be, let me say, an acute lumbago, like what you said you had. You woke up in the morning and you said there was this kind of, excruciating, debilitating pain. Yeah, it might just be an acute lumbago, but it's always very good to be sure that maybe in the nearest future you actually saw it. So, and again, you said, okay, there's a little bit of problem with your movement. You are limping. You cannot, definitely, that is something, part of the signs that you actually have to look out for. Okay, you cannot control your urine. There's a kind of incontinence. Okay, that one is a red flag. That actually might be pointing to cauda-equina syndrome, that you might actually have to go see your orthopedic surgeon. Very, very important. So you see that there's a bit of bowel, the loss of bowel control or bladder control. Please, that's one is that what, quickly go see, your orthopedic surgeon or your doctor. Very, very important.
Thank you so much for that. I asked it because it is important we understand how grave this thing can be, and also because when it concerns pain, any form of pain, we are quick to pop pills, and that is not the long-term solution. So we'll take another breather. When we come back, we will talk about the treatment options available so that people do not just go on and on trying to numb out the pain instead of fixing the root cause. This is Breakfast in Bed here on Smooth 98.1.
We are your number one adult contemporary radio station.
Stay tuned, everyone. Don't even think about touching that dial.
This is not your typical sport.
Brazil today maintaining a very proud record.
This is the game that puts you at the edge of your seat, close to your radio.
It is an incredible start for Arsenal.
The game of wins between rivalries as they battle for goals and victory.
There's a football in.
The game that sends the world into frenzy.
Sandy's cross, 4-0.
This is a game of solid action and not movie fiction.
Summer gets down.
This is your game. Total Football. Get in-depth football analysis on top matches here on Smooth 98.1.
It's all over.
Total Football now on Tuesdays and Thursdays at 7 p.m. and Saturdays at 11 a.m.
Love music.
Hello. Hi, good
My name
morning.
is Alpha,
Sorry, I was
and
on
music
air
to
when
me
you
is
called.
the most potent form of human expression. Music to me is life. Music to me is love.
Love.
And it speaks to the soul.
Oh,
So
wow.
keep listening to Smooth 98.1.
Okay, are you close?
Love music, love life.
Moving,
Okay,
grooving
I
music
have to rush
on
now.
Smooth 98.1.
Smooth 98.1. I love music, I love life. You know, you'll always get the moving, grooving music, but right now it's the smooth, educative talk. We're talking about your health, the back pain, the neck pain, the lower back pain, and of course, what you can do about it. I have my guest, Muyiwa Adejugbagbe. He is a physiotherapist, and right now we will talk about why you should stop popping every pain numbing pills, rather, so that you instead address the root cause. So, like I mentioned, during that time that I had, I'll use myself as a case study now. During that time that I had the pain, it was for a week or two. No, it didn't extend to 2 weeks. Well, I don't even remember, but it was more than a week. I had the urge to really take a painkiller. When I say painkiller, a really strong painkiller, because I just wanted to be okay. I started with taking a normal paracetamol, and I wanted to proceed to taking a higher one, but I just felt no, I am not a fan of drugs on a normal day. So, but that was when I got to the exercise. Now, for a number of people who they don't have the luxury in quotes, they don't have that time in quotes. I say in quotes because when it concerns your health, you have to seek out the help that you need. And they are used to that pain. They've become familiar with that pain. It's just something that is there, and they feel like that pain is not going anywhere. What would you say to them?
Okay. In actually addressing, let me say, the remedial options for battling spine issues at all, is that we should look at the factors. What actually must be responsible in bringing about this pain? Okay, is it posture? Then of course it's very that you need to maintain the proper mechanics, whenever you're sitting, whenever you're sleeping, whenever you're walking. And again, the heels that you wear, what kind of footwears do you wear, what kind of these are very, very important things that if you can just take care of the causal factor, then you most likely you'll be fine. So if someone actually is sleeping on a very terrible mattress, then it's actually very good. So you cannot just keep taking pills. And whereas the mattress is actually very terrible, or the chair that you are sitting, it's like one time I went to an office and they were like, okay, it's actually a broadcasting station, no backrest at all, and the person is just standing upright and typing, and this person works from 8 o'clock to 4 o'clock. Come on, there's no, if you take pills from now to tomorrow, you do a lot of physiotherapy, go for chiropractor, but if you actually don't address you getting a proper economically designed chair, a seat, I tell you, that pain is going to be perennial, it's going to be chronic. So you actually want to really take care of the underlying factor. Again, for someone that is very obese, that is bariatric, you actually have to do some dieting. You have to do work on your abdominal muscles, especially someone that actually have quite protruding stomach. You can take a cue from pregnant women whenever they're actually pregnant and it's getting to the second trimester, the third trimester, because there's an increased lordotic cough at the back. Pain comes, but as soon as they deliver the baby, the back pain most of the time actually disappears. So you actually have to really work on your body weight, the body mass index. You try to get yourself under the normal weight range. And again, another thing again is sedentary lifestyle.
Yeah.
For such a person, like what you said you did, you took paracetamol for some time, some this thing, and afterwards you started doing some stretches. Some yoga actually goes a very long way. Some stretches. Now, this is very, very important when I get up. It's always very good that you should meet your physiotherapist to tell you the kind of stretches, the kind of exercises that you have to do. There's some back pain that is extension bias, that you actually have to do some back extension like a cobra pose, and it works fine. But there's a kind of back pain that if you do that kind of cobra pose, or you do some kind of back stretches, it actually tends to aggravate that let me say mechanical assault going on at the back. So you actually have to meet the professional involved. Okay, what kind of exercises would work for me? And afterwards, to actually maintain my body, to maintain my core muscles, core stabilization, or what have you. Okay, what can I be doing in the long run? Now, in this kind of, and sometimes some back pain, we're actually looking at the non-specific mechanical low back pain. There's some back pains that's maybe as a result of disc herniation. Maybe there's like a disc bulge, there's a kind of protrusion of the disc. In that kind of situation, when you have used all the conventional, you've taken all your pharmacological management, your drugs and what have you, it's very, very advisable to meet your orthopedic surgeon. Of course, you have an idea of the hospital that I work. We do that quite a lot. So you actually have to meet your surgeon. Whether doing some discectomy just to actually chip it out, or doing some decompression surgery, lumbar decompression surgery. If it's for the neck, they do some anterior cervical disc, discectomy and fusion, just to really help. And of course, I've managed quite and been involved in the management and the rehabilitation of such patients, and they came out, with very good outcomes, basically. So surgery is not actually all that bad, but especially when you've been managing something, so this thing is debilitating, no bowel control, is actually, radiculopathy, pain down to legs, you actually having some kind of tingling sensations, as if something is scratching you and what have you. So best thing is that what you need to go and meet your orthopedic surgeon, that even surgery might actually be, the solution. Now, I wouldn't just, emotional and psychological support is also very important. Counseling goes a long way. Some people just telling that, okay, what you're actually going through, the spine is actually a very strong structure. People say, this thing is this, take this kind of hyper concussion and what have you. The spine, like what you said, within 1 week, or let me say a little above 1 week, the back pain actually resolves. So if you actually can really take into consideration every of all these, of course, you've done your part, your chairs are fine, you've done your exercises, your body weight, is actually very much within the normal range, and then you're good to go.
Wow, that is so holistic, literally touching everything. Thank you so much. We possibly cannot even exhaust this topic in 1 hour, and we have to go now. Time really flies by. Well, very sorry we couldn't take your calls. Well, hopefully another time we'll be able to do that, because we anticipated that the time will not be enough. But thank you so much to everybody who wanted to be a part. My guest has been Adejugbagbe Kenneth, and he is the lead physiotherapist, Hospital for Trauma and Surgery. Well, he's also the National PRO1, Nigeria Society of Physiotherapy, and also the Clinical Director, Stroke and Spine Rehab Center. Thank you so much.
Thank you very much. Thank you for having me.
I look forward to another conversation with you where I hope we're not talking about pain, because I think suddenly I have pain in my back now as a result of my sitting. But yes, I'll be sure to take all the recommendation and the advice. And I hope somebody out there too is doing all of that. I'll put up, as usual, I'll put up the link for you on our WhatsApp status so that you get to be a part of the information we have shared. And please share it with somebody, because low back pain, neck pain, and back pain have been ravaging a number of people. So be that relief that they need. Thank you again for being a part of this conversation. Now, 8:40, it will be all about the kids, because they will be live in the studio. We'll be having some great time. After all, it is the Children's Day special. So do not even think of changing the dial. Coming from Michaela the Superstar, is this one titled Grandma Told Me? Thank you.
Appreciate it.
Echo show.
So we're going to take a message.
Yeah. Because
My grandma told me that you can't please everybody. No, you can't
we
please
do,
everybody.
we literally will not be able to.
No, you can't please everybody. No.
I have realized that
that
giving them the information
No, don't even try.
is sometimes better compared to those single questions that they will be asking.
And my mama told me that I can't help everybody. No, you can't help everybody. No, you can't help everybody. No. And my papa told me that you can't be everybody. Be yourself, not everybody. No, you can't be everybody. No. Grandma told me, Makela, me want ya know. Just do your best and don't let nobody put you low. Yeah. Grandma told me, Makela, me want ya know. Just do your best and
Where is
take care
Killable?
of tomorrow.